There's a range of individuals here from different organisations. We have people here from local authorities, sensory teams, social services. We also have individuals representing other charities that we work closely with and receive referrals from. But also important to me is that we've got some of our members here. Some of our members who've attended our groups over the last 3 years. And on top of that, again, you could say, as important, or even more important, is we've got quite a lot of our volunteers, or a few of our volunteers here this morning. And we wouldn't be able to do 90% of the work we provide throughout Wales if it wasn't for the work that our volunteers do. So thank you again to the volunteers for giving up some more of their time to come along to the launch this morning. I'm only going to be up here for a few 10 minutes or so. Unfortunately, the other two speakers, Jeff and Roy, didn't say everything I was going to say, so I wasn't about to say anything. They got away off scot-free. But what I want to do really is identify where the idea for In Touch came about, and then come on to the project itself in a little bit more detail, and then just finish off before we bring Heather up to say a few words about the importance of why we're trying to reduce social isolation for individuals who are deaf-blind. You may or may not be aware that we had another lottery-funded project which lasted over 3 years, which was to establish peer support groups throughout the north and the south of Wales. And luckily we were quite successful with that project. We managed to establish 12 groups, 4 in the north and 8 down here in the south. And from that project, the overall reach and aim, again, very much with this one, is to reduce social isolation and act as an information source for individuals who are deaf-blind. And the feedback we got from it was fantastic. We met our goals and our outcomes. However, one thing that did come back from our members was that the groups weren't for everybody. And probably all of you can relate to that. The groups aren't for everybody in that environment, in that setting. Some of the reasons being, people weren't confident enough to step out into the community, into a group setting. Some people couldn't get there. Others just felt they needed more of a one-to-one sort of social interaction other than the group. So from that feedback and sort of meeting within ourselves as an organisation, we come up with the idea of trying to create a more individualised social befriending service. And we had a great team who managed to put a business plan together, and we went into the Advantage funding and we were successful with it, allowing us over the next 3 years to supply that service. And that's going to come in the form of In Touch. So what is In Touch? What are our aims for In Touch? Well, it's been said a few times already this morning, but In Touch, the overreaching aim and the #1 goal is to reduce social isolation for individuals who are dual sensory impaired. And on top of that, the sort of significant effects from that is to reduce or improve health and well-being and create more community connections. As Jeff has said, it's not all about coming to one service and receiving one service. It's about creating more community connections out in the big society where people can go for other places for support rather than feeling they've just come to one area. So how will we go about it? Well, there's 4 of us working on In Touch. Myself overseeing the project. We have Michael up in the north, project officer for the north, and down in the south we have Sian and Neris split, so we're covering the east and the west. And the aim is to recruit volunteers, receive referrals, and as I said, it's very much an individualised service. So once a referral comes into us, we will go out and meet the individual who's been referred as sort of like a baseline initial contact and identify what their goals are. It's already highlighted to us straight away on their referral form what they're after, but that initial contact just sort of reiterates that, and then we can very much tailor-make it to the goals they want. It may be that they used to go out to Tesco and do their own shopping, but they don't have the confidence anymore, the support to do so. So we can pair a volunteer with them who's sort of been specifically selected to go with that individual, and it can be to get out in the community and go do their shopping again. It may be that they just want someone to come to the house, have a coffee with them, have a chat, read their post for them, just basic things that we all take for granted, and that's the overall aim of In Touch really. So who will benefit from it? Well, individuals who are deaf-blind, over the age of 50, that's who we're targeting. We are hoping to see 120 people over the 3 years of the project. That's our #1 outcome. To give you an idea of the importance of the project, since January, between January, February and March, we've had 112 referrals already. So we've almost met our overall target in 3 months. And that sort of summarises to me that professional organisations, other charities are seeing there's a need for this one-to-one service and a need to reduce social isolation. The other really key figure I just want to bring forward this morning as well is, I think members of the public as well as seeing the importance for it. And I mean that by the number of volunteers we've identified. Somebody said to me the other day that actually over the last 12 months, people volunteering is reduced by 8% UK-wide. Well, in 3 months again, we've identified 64 volunteers for this service. And we're going to keep trying to recruit more. But I think members of the public are seeing the need for this. They're seeing the need to re-engage with other members of the community and help them as much as they can. So social isolation. It's been said quite a lot this morning by myself, Jeff, Roy. Why are we trying to reduce social isolation? A lot of research has been done over the last 10 years to answer this question, and the real reason being is that social isolation occurs as we get older. That's been identified. It may be because our friends and family have passed away, we're unable to access our own transport, we can't get out into the community, we can't use our own transport, so we stay within our own four walls and lose that connection with the community. And if that happens, there's more likelihood that we're going to sort of have an increased effect of all-cause mortality, suffer depression a little bit more, cognitive dysfunction, health problems can be exasperated when we become socially isolated. So we need to reduce that so that people can live independently, live healthier, live with a more improved quality of life for a longer duration. And that's why befriending services like this are important, because they've been shown to have a positive effect on quality of life and health and well-being. I think if you're able to pair somebody up for a preventive service, there's a 50% likelihood that your quality of life will be improved, which is massive. Specifically for individuals who are deaf-blind, and that likelihood of social isolation increasing over the next few years. In 2010 it was identified 16,600 people over the age of 50 are deaf-blind. That's going to rise to about 18,600 by 2015. So with that rise, there's also a risk that there's going to be a rise of people becoming socially isolated. So projects like this are really important because we're going to reduce that social isolation. And like I said, the main goal is that we're creating those friendships, those companionships, those connections to improve quality of life. I think that's the main sort of tagline I want people to leave here with today. We're trying to improve quality of life for individuals who are deaf-blind. Just to give you one more sort of fact, I'm going to blast out research papers left, right and centre. If you're not sure how important